The Honourable Member for Burrows.
Thank you, Madam Speaker. Manitobans dealing with meth addiction and psychosis pose significant challenges for primary health clinics and providers like Norwest Community Health Clinic in the North End. Today I'm joined by Corey and Amy up in the gallery from the Norwest Clinic, and between managing wait rooms, medical needs, finding safe transportation, and places to stay for extended detox and support, Norwest desperately needs more resources. Madam Speaker, members of Norwest want to know what this government is going to do to help support primary care clinics and how other government services could be of support.
The Honourable Minister of Health.
Thank you, Madam Speaker. The government is taking real action when it comes to the sudden and shocking rise of the use of methamphetamines in our communities. We know that it's a challenge that faces all of us together, everything from frontline care workers to the justice system, family system. It's a challenge in our communities, it's a challenge in our families. But Manitobans don't have to wait, because the government is taking action now in respect of rapid access to addictions medicine clinic. In addition to that, we are training more doctors to have addictions specialties, and we are increasing the number of beds in which to treat people with addictions, and there's much more to come.
The Honourable Member for Burrows on a supplementary question.
Madam Speaker, there continues to be increased infection rates related to meth addiction and needle injection. People in the North End feel that they're being overlooked. And from a primary healthcare and public healthcare perspective, there needs to be more harm reduction and preventative practices in this community. Madam Speaker, allow me to ask another question on behalf of a staff member at Norwest Clinic. What can the government do immediately to support harm reduction in our community through our resource centres and community clinics?
The Honourable Minister of Health, Seniors and Active Living.
I thank the member for the question. What can the government do immediately is to put more resources in communities where people would be able to get quicker treatment on addictions than they had at any point in time previously in Manitoba. And we're doing that with the Rapid Addictions Medicines Clinics, which has just seen its 200th patient, some of them immediately diverted from community into care where they're receiving the help they need. These are complex problems. It will take all of us to solve them together, but we are making progress and continuing to talk with others about how to make our next steps.
The Honourable Member for Burrows on a final supplementary.
Madam Speaker, the members of Norwest Clinic have noticed the impacts that methamphetamine has had on their community as a whole. Children and others are facing this addiction on their streets, their sidewalks, their playgrounds. There are individuals who have used and are now trying to re-establish themselves after treatment back home, but there just are not enough resources. Madam Speaker, again, to quote a member from the Norwest Clinic, how does this government plan to support the long-term impacts on individuals, families, and communities that have been impacted by methamphetamine?
The Honourable Minister of Health, Seniors and Active Living.
I welcome members from the Norwest Clinic here today. That member knows as well that we have said we're very open to suggestions coming from anybody on how to deal with this. We know that no one has the one fundamental answer when it comes to dealing with this very sudden rise of methamphetamine use in our communities. Today, Manitobans will hear about additional measures being undertaken in the WRHA at HSC to keep patients and to keep staff there safe.
Order.
But while the leader of the opposition continues to chirp, he's not learning about the important things that this government is doing to make real demonstrations of commitment and make a difference in people's lives. We'll keep doing it, and if the member has additional options that we should consider, I welcome her to send those along.
Hear, hear.